video, we will study about the classification of symptoms and different approaches to erect the totality. To start with, let's go through the following table. Symptoms are divided into two categories, general and particular. General symptoms are further divided into characteristic and common. When we talk about characteristic symptoms, they are further subdivided into three: mental, physical, and pathological. Mental comprises of emotional and intellectual symptoms. Emotional like anxiety, fear, anger, various feelings with time and circumstances. Whereas intellectual symptoms are memory, thoughts, comprehension, disorders or perceptions, dreams, etc. When we talk about physical symptoms, it is generally the sensation, pain, motion, gesture, sweat, food, desire, aversion and intolerance, modalities, sleep and sexual perversions. Whereas when we talk about pathology or pathological symptoms, it is the peculiar pathology and tissue changes, the discharges, the pathology common to more than one organ or part. When we talk about common symptoms, it is either mental or physical. Again, the mental constitute the emotional and intellectual part, and physicals include sensation, pains, common pathology, discharges, and modalities. When we talk about the particular symptoms, they are divided into two parts, again the characteristic and the common symptoms. Here, both the things are common, that is, they focus more on sensation, pain, pathology, discharges, and modalities. Dr. Henneman's views. Dr. Henneman classified symptoms into two: general symptoms or the uncommon symptoms. Now, Hennemanian concept of general symptom is same with the common symptoms of Kent. Uncommon symptoms: any symptom which is unaccountable, unexplainable, absurd or paradoxical. This symptom is found in a few patients in the proving of few medicines. For example, coryza relieved by cold bath, burning relieved by application of heat. The uncommon symptoms which reflect the individuality of the patient are of great value in the selection of homeopathic medicine according to Dr. Henneman. Let's move forward to Dr. Kent's views. Dr. Kent has classified the symptoms into three main categories: general, common, and particular. General symptoms: all the sensations or symptoms that the patient predicates of himself or in the relating of which he uses the personal pronoun I are general symptoms. Particular symptoms are those symptoms which are related to a particular part or organ of the body. The first grade particulars are those that are peculiar, uncommon, unexpected, unaccountable, rare, unusual, and odd. The second grade particulars are particulars with marked modalities. And the third grade particulars are those having no appreciable modality. Common symptoms. Now, these symptoms are valueless unless qualified with modalities. Common symptoms are common to any patient suffering from certain disease or complaint. They are of least importance because they will be found in almost every drug disease in one form or the other. Now let's talk about Dr. Boninghassen's method. He proposed the 7 points in order to study the sick individual to form a totality. In his words, according to which a moral disease is to be judged as to its peculiarity and grievousness. Quis, quid, ubi, cubis, auxilis, cure, quomodo, and quando. These are the 7 points. Quis means the personality of the individual, which comprises of his age, sex, bodily constitution, and temperament. Quid stands for nature and peculiarity of the disease. UB stands for seat of the disease. Cubis auxilis stands for associated symptoms. Cure stands for the cause of the disease. Quomodo stands for the modifying factors, and quando stands for the time of appearance of aggravation or relief. To summarize the above concept, and for practical purpose of forming a totality as well as for repertorization, his method of classification can be best done with the location, sensation, modality and concomitant. Now let's talk about Dr. Garth Borik's views. He has divided the symptoms into two classes. First one is the basic or absolute symptom. Second one is the determinative symptom. Basic or absolute symptom are those that appear in every proving and are of general nature and usually diagnostically important. Example: malaise, headache, weakness, anorexia, eructation, fever, and pain. They are of little value to determine the homeopathic drug indicated, but taken together furnishing a suggestive beginning. Whereas determinative symptoms are individual or personal ones found in a patient, or a characteristic, keynote, or guiding symptom found in drugs pathogenesis. Let's look into Dr. Boger's views. Boger's interpretation of characteristic symptom is quite logical and a little different, but very much in line with the principle of individualization and generalization. If a modality is applicable to many complaints, like hot application relieves abdominal pain, toothache, throat pain, it characterizes the totality. He also gives importance to causative modality and time dimensions attached to the symptoms. If the patient shows affection of a particular type of tissue, that is tissue affinities, like a person gets affected on tonsils, liver, thyroid, the particular type of tissue is gland, so here gland will be characteristic. If a common pathology affects the person on different part, that pathology will be characteristic. Suppose pathological general like degeneration, atrophy, growth, tumors, etc. Dr. Boger has emphasized on genius symptoms, that is, the strain runs through every pathogenetic symptom complex of drug and the disease. Thank you for watching.